Hey guys, Dr. Colin Neumann here, and don't judge us for no mask wearing. We're trying to do this so you guys can hear us and see us a little better. But I'm here with one of my patients, David Barclay, and we wanted to kind of talk about what's brought him in to see me and what we did to help him address the things that were bothering him the most. And so when you first came to see me, what was bothering you the most?
We had actually, I have to say, was bothering my wife was the snoring issue, as well as just being congested. Seemed like my nose was stopped up constantly.
Yeah. And so when I first looked in his nose, he has a very badly deviated septum, which the septum is the piece of bone and cartilage in the nose that separates right to left. And right off the bat, yes, his is very, very deviated to the left. Now, we also decongested his nose to shrink down these little bumps called turbinates. And what happened after we decongested?
Immediately, I was able to breathe 100% better, almost instantly.
And I remember you saying that if I could breathe like this, that'd be awesome.
Yes.
And so right there, I realized that even though his septum was very badly deviated, that the septum probably was not the thing that bothered him the most, since he was having congestion issues on both sides. And after decongesting his nose, these turbinates with that medication, he could breathe better on both sides, not just the right side. And so from that standpoint going forward, I didn't even care about his septum. I really thought that, look, if we can shrink down his turbinates, again, these little bumps on the side of the nose, that was going to get him breathing better and address the things that bothered he and his wife the most. Now, the difference between these two procedures is night and day. When we straighten out somebody's septum, that is a trip to the operating room. Usually takes about anywhere from 30 minutes up to 90 minutes to do. Decently painful recovery. Usually we have to leave pieces of plastic splints inside the nose for a week afterwards to keep the septum straight. And what did you tell me if I'd offer that to you?
I was going to refuse that treatment.
Yeah, because he's in law enforcement. He could not be down for a week at a time, and that recovery just didn't sound great. And, you know, I never like to bring in cost into decision making, but a trip to the operating room takes into account not just the surgeon's fees, but anesthesia time and operating room time, which can be very costly. And a lot of people have high deductible plans these days, and even with great insurance, that can be thousands of dollars. And so we did a procedure in the office called a turbinate reduction. We did this under some IV sedation. And what was your experience with the IV anesthesia sedation?
It was great. The medication was obviously quick acting. Once I woke up, I did not have any drowsiness. Within about 5 minutes, I would be completely aware. I was able to walk out on my own and left here and went to Chick-fil-A and ended up eating lunch.
And what was the recovery like for you?
The recovery was discomfort. Not painful. I'd say it was discomfort. Surprising. I expected to have a little bit more discomfort than was there, but it wasn't bad at all.
And what did you end up paying out of pocket?
This was right around $700 out of pocket. So again, I understand it was $700 and $700 is a lot of money. But at the same time, compared to what it could have been on other procedures and for the results, a very good bang for the buck.
And what did you do the next day?
I went back to work.
And that was the biggest thing. He was back doing his job the next day. No downtime, no recovery. So again, you know, he came in with a problem. In the past, he would have had a septoplasty, or I would have offered him a septoplasty. Respectfully declined that. And so we were able to achieve his goals, save him thousands of dollars, save him recovery, and again, get a great outcome. And so, yeah, he is, I pray to everybody about him because he was a model patient. And I'm just really, really happy that he got the outcome that we were looking for him. And so at this point, I told you, when am I going to see you back?
Whenever I had an issue.
Exactly. So we followed up with you about a month afterwards.
Yes.
You were doing great. I said, see you later.
But at the same time, I'll say, was very open. If you have any issues, any questions, anything at all, feel free to contact me, get a hold of the office. We'll get back with you. And that was a nice feeling to have.
When people come in with nasal congestion, issues breathing through the nose, it may not be a terminal issue. It may be something different. Every person's different. And that's why it's beneficial to come in, have us take a look at your nose, and determine if you are going to benefit from one of these minimally invasive procedures. Some people need the septoplasty. If you told me that his biggest issue was always never being able to breathe through his left side of his nose, I would have said that would have been the right thing to do for him. So every patient is different. You can't do broad strokes. Everything is a case-by-case thing. But yes, let us take a look at your nose and see what we can do to help you.